Now we are going to expose or to examine one patient have a cut wound in his fourth finger. We want to stitch that wound because to promote healing. So this is the wound. First we clean the wound by disinfection. We put some disinfectant here to make sterilization first, because this is potentially infected wound. Then we are going to give some analgesics, some anesthesia, sorry, because this is edge wound, so we are going to give anesthesia from here to all area of the wound. This is most sensitive area, so it is better to go from here, go to one edge. Don't look at me. So like this, we are going to give anesthesia so as to be relaxed, and the patient will be relaxed during stitching and after stitching. Tell him, don't look, don't look. I don't know. We are going to use 2-0 cut wound, cut edge, stitching threads. The point is we want to approximate these two edges to promote healing and make a good cosmetic appearance of this area. So we can start from here. At this edge we will take a good grip from here to here. This is the first. I don't know, maybe you need another one or not. So this is a good successful edge wound. Okay, thank you. Then we will have a look here to maybe this is good enough. No, this is enough. Just one stitch, but yeah, if you organize yourself and think where you the best place to put your stitch. This is an important. So instead of having multiple stitches, stitch here a good grip from this side to this side, control the bleeding and approximate the edges, and that's what we want to do efficiently without we need anything else. Thank you, my friends.